Did you know that epilepsy affects over 3 million Americans of all ages, more than multiple sclerosis, cerebral palsy, muscular dystrophy, and Parkinson's disease combined? Almost 500 new cases of epilepsy are diagnosed every day in the United States. Epilepsy affects 50 million people worldwide. Did you know that epilepsy can develop at any age and can be a result of genetics, stroke, head injury, and many other factors? Historically, epilepsy research has been underfunded. Federal dollars spent on research pale in comparison to those spent on other illnesses, many of which affect fewer people than epilepsy.
Epilepsy is extremely common, particularly in children, and it's something that many times people are unaware of just how common it really is, because it can be your neighbor or your friend, but people don't necessarily discuss the fact that their children are having seizures. And so many times people will learn that it could be their child's classmate or somebody very close to them who's also going through the same situation. And but all the pediatricians and the neurologists are very busy with epilepsy because it's such a common condition. And so what the Saravos have done is they've provided a Rhode Island-based service that is helping families connect, helping families get the information they need, and helping them learn to deal with the condition that's so difficult for families sometimes to do on their own. And it's really the only Rhode Island service focused in the state that's doing that and helping kids and families directly with this condition.
I think the first time I thought about reaching out to find others in the community that had epilepsy, I was directed to the Matthew Saravo Foundation, where I found a lot of resources for other people in the community that helped me along with all kinds of information, doctors, medicine, people that were having similar seizures to Ava, to where it helped me so much knowing that there are other people in the community that I can connect with. And I love the Saravo Foundation because it's one central place that their resource center in Wakefield has, where you can access all of that information and be connected with other families and just be involved in a community of people that are dealing with similar situations and understand what your life is like.
The Matthew Saravo Memorial Foundation, the center, has helped our family out tremendously. Several years ago, Eric and I were really struggling. We felt very alone. We were looking for support, and when I met Debbie and Richard, and my husband met Debbie and Richard, it just changed our lives. They've touched our lives tremendously. I can't even tell you how good it feels to know that we have love and support, and that there are other people out there like us that are living with this on a daily basis and understand what we're going through. I can't even express in words how wonderful they have been to us.
I mean, I've sent a lot of families to the Saravos because they can supply something that sometimes I can't always as a physician. And so the feedback I've gotten has always been universally that the families have found it very helpful to meet, to get the information, and sometimes just to talk. And it's one thing to have some of those discussions with your physician, but it's very different when you're talking to a family that's been there and that understands and that really knows what this family is dealing with. And that's something that Saravos can provide, in addition to the fact that they, through their resources within the office, but also through their connections around the state, they often can help people make connections with others in the area, whether it's helping finding family with children with a similar age or similar condition, or helping even siblings in terms of coping with some of the issues related to their brother or sister. So it's through making those connections that they've done a lot of the work that's been so helpful.
I have to say the Matthew Saravo Foundation was a gift that was given to me, and I mean that with all of my heart. After Megan went into the hospital the first time for her 72-hour EEG, and we actually found out that she had a completely different type of epilepsy that we initially thought she had. And Dr. Gaetanis said, you know, you really need to call these people. And he said, you know, Deb and Rick are the type of people that created something out of pure love and desire to help somebody else. And you I think he could see in my eyes on how incredibly overwhelmed and scared I was at that point.
The Matthew Saravo Memorial Foundation has been a great resource for us in a lot of ways. I think first and foremost, we got connected with the support group, the Discovering ME support group, and that has just been terrific for our whole family. We've met some other families and made some good friends that way. We have had the opportunity to talk with other families about what their challenges are, to sort of compare notes on medications and doctors and you know, just sort of the different challenges that everybody's facing. So that's been great. And because the Matthew Saravo Memorial Foundation supports the support group, that's, you know, just been first and foremost the biggest thing, because that we got connected with that support group very early on, and that's been a huge help to us.
When we consider the fact that about 1% of people have epilepsy, and it's such a common condition, and you compare that with other medical conditions that receive high levels of research funding, which are much less common, it really demonstrates, I think, the need for continued research and support. And then you couple that with the fact that so many kids have seizures that we can't treat with our available medications. So about 30% to 40% of kids are kids that are not going to respond to the medications we have available, and that really highlights the need for continued research and continued improvements in the area. And that's one reason that the Saravos have chosen research as one of the areas that they want to help. And so they've helped fund a project through CURE in the previous year, and have now made a commitment to working with scientists, neuroscientists, and physicians at Brown University to help advance some of the epilepsy research that's happening right here within Rhode Island. And that's going to hopefully have a direct impact in improving the health and well-being of the kids that we're working with.
The Matthew Saravo Foundation has been wonderful for all of us as a family. I mean, we've partaken in the Snow Angel Ball and been very involved with that. I'm on the board of directors, and also Taylor, actually, my daughter, ran one year in the run. TJ and Taylor's grandparents also walk it or do the run as well. And just having that whole environment of other people that do have epilepsy and that are involved with this program and raising money for an awareness for epilepsy, because I think many years ago, as you know, I'm finding out as I talk to people, so many people I know have epilepsy and we never knew it and can't believe the people that have it. And it's like a stigma, or was a stigma, but I think now it's definitely, the awareness is out there. They realize that people have all different types of epilepsy, and the more we can put into research, the more hopefully we can help the children and adults with the epilepsy.
When we first found out about James's diagnosis with infantile spasms and what has since developed, multiple seizure types that he's shown at various points in time, we looked up to see what are the treatments, what are the possibilities. And what we found consistently in all of the literature is that there isn't money for research to come up with solutions.
The only way we can accomplish our mission is to seek support from our friends, businesses, and the general public. With your support, we will be able to improve the quality of life for a growing number of children and families living with the many challenges of epilepsy. Through the efforts of Matthew's Foundation, Matthew indeed continues to touch the lives of so many children and families.
Life's a journey full of paths and dreams. We follow our hearts, seen through seeing. No one knows what life will bring tomorrow, for seasons will change. It's a guide for us to follow, 'cause we're all on the road that we choose to follow. No destination promised, just a journey through tomorrow. Breezy autumn days, winds that always change. Whoa, whoa. watch them change when she walks on by, passing by. When she walks on by,